My name is Sophie Flux and I run a company called Animal Aiders. We provide veterinary-led dog first aid courses for dog owners, dog trainers, hydrotherapists, anybody who has an interest in dogs. And we've been running this company since 2006. I'm here to talk about basic health signs and how to check your dog. Basically, every day, just have a quick look over them. By doing that, it helps you to monitor the welfare and well-being of your dog. So the first thing to do is to listen, watch and observe. So listen for your dog's breathing. Do they sound like they do every day? Or perhaps are they feeling a bit raspy or sounding a bit raspy in how they're actually breathing? Watch them. Obviously, as soon as you look at them, you're taking in lots of information about the way that they're standing or perhaps sitting, or even in their facial expressions. Feel for lumps and bumps. When your dog greets you and comes up to say hello, then you can place your hands over the dog, feeling from the head back down to the tip of its tail. Dogs can suffer from things such as grass seeds, where they'll get lumps in their paws, so it's good to feel around their toes every day to see if there's something abnormal in there. Check around their genitals, see if there's any discharge. At the head end as well, of course, there's the important area of your dog's teeth. It's always good to have a look there to see if there's any changes. The heart rate and pulse rate of a dog is a good indication of your dog's health. The easiest way to take your dog's heart rate and pulse rate is actually by either putting your hand around the dog's thigh and searching for an artery that's right inside the dog's groin. By doing that, placing your hand firmly there, you'll be able to feel your dog's pulse. Now, the average dog's pulse is anything between 80 and 120 beats per minute. However, little dogs might have a much higher average rate of say 130 or even 140 beats per minute, whereas really big dogs and fit dogs may have a very low pulse rate of say 70 or even 60 beats per minute. But whatever is normal for your dog is your dog's pulse rate. The other way of feeling for your dog's heart rate is by actually placing a hand over their chest. However, obviously your dog's breathing as well, so that can interrupt that. Respiratory rate is another important basic health sign for you to record in your dog. The average dog's respiratory rate is 16 to 20 breaths per minute. And as in heart rate and pulse rate, if you have a particularly large dog, they will take less breaths per minute. And if you have a small dog, they will take more breaths per minute. And whatever is normal for your dog is your dog's breaths per minute. What a respiratory rate unit is when your dog breathes in and it breathes out, that's 1 unit. So when you're monitoring it, don't think in is 1 and 2 is out. It's a common mistake that people make. To monitor your dog's breathing, it's good to do it when they're at rest. So when they're sitting down and calm, that's when you can measure their respiratory rate. You can either do it by placing your hand on their chest and their chest lifts up and then down again, or by just looking at it. Dogs obviously pant. This is actually nothing to necessarily do with normal respiratory rate. When your dog is hot or run around a lot, then their panting will increase. But this isn't anything necessarily to do with normal breathing. In basic health signs, we're looking at when they're calm and at rest, and that is the rate that you need to be taking notice of and not the panting. Observing your dog not only means looking at how they're breathing and their heart rate and how their eyes look, it's also looking about what's going into your dog and what's going out of your dog. As a conscientious dog owner, you will be picking up dog poo, so therefore you do know roughly what is coming out of your dog. The average dog poo, again with everything else, depends on your typical dog. But most dogs' poos are a brown sausage shape, so that's what you should be looking for. If a dog is suddenly becoming quite loose in their stools or particularly hard in their stools, that's something that you need to note and to record. And if it goes on longer for 48 hours, I would consider speaking to your vet about your dog. Often what comes out is due to what is going in. The average dog should have between 50 and 60 millilitres of liquid per kilogram. And obviously there is a wide range of dogs, but it is useful to know from weighing your dog how much roughly your dog should be drinking per day. So a 10 kilo dog will drink approximately a pint of water per day. If they start drinking far too much compared to normal, then that could suggest that there is something going on which might be sinister, such as diabetes. So if you think your dog's started drinking too much, you should consult your vet. If, however, your dog has started to not want to drink, this might also be an indicator that something's beginning to go wrong with your dog. So monitor them for a few days. If they're still not drinking like they normally do, then please pick up the phone and speak to your veterinary surgery. It is important, especially in our country, because dog obesity is rising at a phenomenal rate, to monitor your dog's weight. The best way of doing this is in fact visiting your vets. Most vets will have weighing scales in their surgery where you can just pop in, take your dog, get them to sit down on the scales, and if you do that monthly, you'll be able to get an average of your dog's weight. Also, by doing this, if your dog does start to increase in weight, you will notice this easily. Also, perhaps if they start losing weight, not so common, but it is important to keep an eye on this, as this will show the health of your dog. Your dog's gums are a really good place to look for your dog's basic health signs. Some dogs have plaque build-up. It's a good thing to keep an eye on those. Looking at the health of your dog's teeth and your gums is a really good indicator of many signs. The three things that you're looking for there is hydration of your dog, also looking at their mucous membranes, and also capillary refill time. So hydration. What this means is the amount of liquid in your dog's system. So the majority of dogs will have glossy, sticky-ish, slimy gums. If your dog's becoming dehydrated, that lovely slimy, slightly stickiness will become very sticky and the gums could even feel dry. Another method of feeling for hydration or looking for hydration is a test which you'll often see vets do, which is called the pinch test. And when a dog comes in and the vet comes to assess your dog, they will feel between their shoulders or on their neck and they will pinch them and then let go and see if it bounces back. Some dogs which are suffering from dehydration will have a thing called skin tenting at this point, where the skin stays up in a ridge. So that can show dehydration. But as an owner, it's always much more easier to actually look inside your dog's gums and feel for those. So if you think that they're suffering from dehydration, they'll feel quite sticky and dry rather than that lovely slime that you're used to with your dog. The next test to do with the gums is a mucous membranes test, and that shows or indicates the amount of oxygen within the blood. The average dog will have a lovely salmon pink to their gums. Dogs do have black pigment within their gums, but you need to ignore that. You want to look at the pink. If, however, you own a Chow Chow, which is a dog which basically has black tongue and black gums, this is something that you can't do on them. But the average dog does have pink in their gums. So when you look at their pink gum, hopefully it is looking pink. If for any reason, however, it's looking particularly pale or even yellow, or in fact bright red, that's an indicator that something's not quite right with your dog. Pale means that your dog perhaps is about to go into or is suffering from shock. If they're yellow, it means they could have a problem with their liver, and that's showing jaundice. And if it's a deep red, that's suggesting poisoning, especially carbon monoxide poisoning, or even an indicator of heat stroke. So that's a really good place to look if you are in fact concerned about your dog. The final place and thing to look for in your dog's gums is capillary refill time. Now this is a test which doctors also perform on humans, and it's when people press into the nail, and by pressing you're displacing the blood out of the capillaries, and then when you remove the pressure then the blood rushes back. Now you can't do that on your dog's claws, but you can do it in your dog's mouth. So what you want to do is to press into the pink area of their gums, and you remove your finger. The average healthy dog will have capillary refill return of 1 to 2 seconds. If this is taking much longer, then that suggests that your dog is suffering and could be having a problem with the amount of blood within their body. If, however, it seems instantaneous and in fact that the blood isn't removed, then that could mean that your dog is in fact suffering from high blood pressure, and that's not a healthy sign for your dog. So if you see that it's taking a long time for the capillary refill to return, or a very instantaneous short time for it to return, then look at the rest of your dog and then pick up the phone and speak to your vet. Dogs' ears do have a special smell of their own, and it's good to be familiar with your dog's average smell of their ears. If, however, their ears differ from the average smell of your dog's ears, then it's worth speaking to your vet, because this could indicate that they've got a fungal infection, a yeast infection, or any sort of infection. And an ear infection is not only very painful for your dog, but also can lead to long-term problems for your dog. So it's good to jump on these as soon as possible. Another place to look is your dog's nose. Now, in history, people have always said that a dog should have a lovely, wet, slimy nose. But in fact, every dog is different, and some dogs, it's just normal for them to have a dry nose. So if your dog's always had a dry nose, then that's totally fine. But if your dog's always had quite a moist, wet nose, if they suddenly become dry and cracked, that's another thing to talk to your vet about. Eyes are also an important place to look when you're looking and monitoring the whole health of your dog. Some dogs do suffer from issues with their eyes, where their eyelids might slightly turn in and cause problems to your dog's eyes, or they could have a problem with their third eyelid, or anything else really. You want to get your dog to look as normal as they've always looked. So if there's a change in the appearance of your dog's eyes, if they start to begin to look cloudy, or there's lots of discharge, or if in fact they're looking sunken, then that's another indicator that your dog's not feeling well. So you do need to speak to your vet about any of the above. Taking your dog's temperature is something that not many dog owners like to do, but it's a really good thing to do if you are concerned about how your dog is feeling. This is because an increase in temperature may not only indicate that your dog is suffering from inflammation or an infection, but also when dogs are in pain, their temperature does rise. So it is worth doing that. Now, the average dog's healthy temperature in Fahrenheit is between 100.5 and 102.5. In Celsius, it's between 37.7 and 39.5, but these may vary for the average dog. What you want to know is what is healthy for your dog, and then when you are worried about them and then you take your temperature, you can base it on that average which you've taken in the past. As an owner, you know what's normal for your dog. So if for any reason you look at your dog and you think they're not looking quite right, then do your basic health signs which we've discussed, record those, and then pick up the phone and speak to your vet, and then take them to your vet. Because whatever you have noticed might just be the start of something, and if you catch it early and take your dog to your vet, then they'll hopefully be able to treat them. If you would like to know more about dog first aid, then please visit our website. We run dog first aid courses all over the UK, from the west to the north to the south and the east, and we may be running a course near you very soon. Our website is www.animalaiders.co.uk.